Hi, my name is Erica Sutton and my student ID is 3648426. This video is for the fall 2025 semester for the veterinary nursing class. Thank you.
Alright, so in this video, I'll be demonstrating how to do the Schreiber tear test on a patient. I have my two test strips right here, and then I have my patient that I'll be using. So first I'm going to open up the tear tests. And I am going to bend it while it's in the package, just so I don't touch the eye part. When I take them out. So I just bent it in the packaging so that they're nice and bent. So you can see I did bend it a little bit. So I'll put one in and then I'll put the other in, and we let them sit in the eyeball. And as the tears go up, that's the reading that we read according to the number, and we'll keep them in the eye for 1 minute. So you want to apply it by kind of pulling out his eyelid and getting it, getting it under the eyelid and then keeping it in like that. And then I'll do the same for the other eye. Not touching the part that goes into the eye. I know them. My strip isn't cooperating. There we go. Okay. So it's already been about 10 seconds with the one in, so we'll keep these in for a minute and read them when they're done. So you want them to be, you want the tears to reach at least 15 millimeters in 1 minute. Anything under 10 is concerning. Anything above that is good, and that means they have good tear production. I know you're being so good. So you just let them sit. What a good boy. And then if at any point during that minute it does go above the 30, then you could just take it out and call them good. A little bit longer.
Back teeth, but she doesn't have anything in the front.
Okay, so this one's been 1 minute.
I got two charts.
This one, I know. His number was 20, so that's good, and that's normal tear production. And now this one's good as well. And that one has also been 20, so this dog has good tear production in his eyes. So in this video, I'll be demonstrating how to fluorescein stain a patient's eyes. So I have my materials here. We do have the liquid form of the stain that has prilocaine in it to also numb the eye, so it's an all-in-one drop. I have gauze and flush to later flush out the eyes once this has taken a little effect. So what I'm going to do is open this. It has a little dropper, so I'll get some of the stain in here. And you just want to apply one drop to each eye. So you just open the patient's eyes and just drop in one drop into each. And that's one. I know, it's okay. There we go. And then we want that to take effect for a little bit. So we'll come back in 5 minutes to flush out the eye. Okay, now that it's been 5 minutes, we're gonna come back and flush out the eyes. And then I do have the otoscope that has the eyepiece on it, and we're gonna look at it with the green light to make sure afterwards that there's no ulcers that the stain uptook. So I get some gauze, put it under the eyes, and then just flush them out a little bit. I know, it's okay. Just flush them out a little bit, and you can do both of them. I know. And then we have the lights off in the room, so now you can turn your light on and peek in the eyes and see if you see any stain uptake. So it'll kind of coagulate on any ulcers that they might have. They're not doing anything. Good. And he doesn't seem to have any stain uptake, so I'd say he has no ulcers in the eyes. And you can also look in their nose as well to see if there's any stain uptake. And that'll show that the lacrimal ducts are working correctly. So his looks all good.
In this video, I'll be demonstrating how to do the tonometry reading on a canine patient. We do have our tonovet here, so this will read the intraocular eye pressures that they have. A normal value will be about between 10 and 20. Anything over that could indicate glaucoma in the patient. So what we're going to do is turn it on. And then this is the cap just to cover the area, but I have my new eyepiece in here, so I'm just going to open that up. And then you don't want to touch the actual end that goes into the eye, so I load it while it's in the plastic case. There we go. And it'll go in there. So this is ready to measure. So you want to make sure you're going to open the patient's eyelids up, and you want to make sure your holder doesn't apply too much pressure around the neck or the head area, which could alter the results. And then your machine is going to be perpendicular to the face. So you can start with the one eye, and this is ready to measure. So we'll do this eye. So ours is going to be green when it's ready for you to hit it. And if you're too far, it'll tell you. If you're too close, it'll tell you. If you need to repeat it. Perfect. So that one was 21 for his eye, and then we can do the other reading. So it'll turn red when you're not in the correct position or if it's not a good reading. So this is red now. You want to... I know, it's okay. We're just going to do that again. There we go. So that one was 22. All right. And then once you're done, you can let your patient up and record your readings and just let the doctor know the readings. In this video, I'll be demonstrating how to give an enema to a patient. So I have all my materials here. I have a bowl to put the enema in. I have my syringe and urinary catheter that I'll be using, a red rubber, a lube, and then Dawn dish soap as well. So first I'll fill my bowl up with some water, which I already warmed it up over here. Ideally, you do want to make sure that it is warm water and not cool water going up there because it'll be more comfortable for the patient. So now that I filled it a little bit up with water, I'm going to put some Dawn dish soap in there, just a good squirt. And then also some lube as well, and the same thing, just depending on what your, how much you put in the bowl, you could just kind of look at it and see how much lube you want to put in there. So now I like to get my syringe and I'll kind of mix it up a little bit just to make sure that it's all nice and mixed. And then once that's good, you can pull it up in the syringe. So we're going to give this patient 30 mils of an enema. So I'll only fill it up to the 30 mil mark. Okay, and then I will grab my red rubber. And I'll open it up, and then I like to, I'll put some lube on the paper of the red rubber just to stick it in afterwards, just a drop of the lube. I'll attach my syringe to the red rubber. And then once I have it on, I just push it a little bit to make sure it comes out. And if you want to suck it back up to the 30 mLs, you can. And then I will lube up the end of it for the patient. And then what you're gonna do is you're gonna grab it like this. You're gonna lift up the tail, and then you can start inserting it in. As far as you can go, I'm using a small-ish red rubber for this patient. If you wanna go bigger for a bigger dog, you could, but for his comfortability, I'm able to push it through this. It's not too thick to push it through, and it'll be a good size for him. Thank you. In this video, I'll be demonstrating how to do an anal gland expression on a canine patient. So I have all my materials here. What I have is I'm wearing gloves. I got some lube to lube up my finger. I have some Miracle Groom spray to clean the rectum afterwards. And then I also have some dry gauze to hold while I'm expressing the anal glands, and then some spray to spray at the end. So what you do first is you want to lube up your finger that you're going to use. So the ideal finger would be your index finger. I do usually get my gauze and just hold some up while I'm doing this, so in case they squirt. So you're gonna lift up the tail and enter the rectum. And then the anal glands are gonna be at 5 and 7 o'clock. So it's not too far in. And then what you're gonna do is, as soon as you have the little, it should feel like a little ball at the 5 and 7 o'clock. And I'm gonna squeeze gently and kind of milk it out. All right, and then now that I did one, I'm gonna do the other one as well. And just gently milk both of them out. Okay, now I gotta clean everything up. Don't wanna get the dog dirty. I'm gonna take my Miracle Groom spray and wipe the area with that. Take my gloves off, and then at the end I'll spray the Miracle Groom. There we go. And that is it. In this video I'll be demonstrating how to apply a topical medication to a feline patient. This cat is sedated. We have her on a monitor right now. So in order to do so, we want to open up the medication, and this is Revolution, so it's a topical flea and tick and heartworm prevention for cats. So I'm going to open my medication up. I do that just by pressing on the lid of it, and then I have it open. So what you want to do with cats is you want to apply the medication on the base of the skull, kind of high up on the neck, and you want to part the hair so that you're getting it on their skin. So I'll take my lid off my medication, and then I'm going to apply it to the skin area and just squeeze it on there. And this way the cat can't turn around with its head and reach up and lick the medication. If you put it too low between the shoulder blades, they can do that and ingest the medication accidentally and can even become sick from it. So now you just want to warn owners that not to touch the area, and if they do so, they could just wash their hands. Thank you.